Hi, my name is Gerry Ross. I'm a physiotherapist at Ross Physiotherapy Solutions in Georgetown, Ontario. I'm going to provide you with some information on how to alleviate back pain. It's important to understand that this information doesn't in any way tell you why your back is sore. And it's very important that you understand why it is sore and get a proper diagnosis from a physiotherapist or physician, because although rare, it can occur that people can get medical conditions that cause low back pain that do initially respond to this type of advice, but require very, very different treatment. And if it's delayed, it can cause great harm to you. So get a proper diagnosis. Some of the major principles of getting acute back pain to settle down and become manageable is to take the weight of your head and neck and your shoulders, chest off of your low back. So there are two positions that work well for a lot of people. I'll show you both of them. The first one is lying on your side. These can be done on a bed or on the floor. If you can't get down to the floor, well, then do them on a bed. This one here is well suited to the situation when you can only lie down on a bed. So what you do is you get a thin pillow or maybe a beach blanket, and you fold it up, because what's going to happen is it's going to support your spine below your ribs and above your pelvis. Going down onto your side, sit tall, tighten your core a little bit, and walk yourself down as your core is tight. Get those legs on the bed, and down you are. You may have to play with what you choose to use here. It needs to be supportive, but not feel obtrusive and aggravating relative to nothing being there. It's supposed to be better. Take the pillows that you have under your head and take the top one and make it diagonal so it supports your neck. Adjust the thickness of the pillows so that your head is in line with your torso, or maybe a little above or a little below, whatever suits you, but not in the extreme. And here on the chair, I have a long pillow. When they're sold new, they're a lot bigger, but they're helpful in that you put them in front of you so your arm and leg rest on them, and that can be helpful in keeping your upper and your lower body lined up on one another. The size depends on the size of you compared to the pillow, so you may find that taking a knife and cutting the end and getting some stuffing out of there and then stapling it back up or sewing it back up will give you a size that feels better. Trial and error is part of this process, so find something that feels good. So that's the side lying position. I'm going to show you now lying on your back. Again, this can be done on the floor, on a carpeted floor with a couple quilts and a stool and a couple pillows. It's not as well suited to being used on a bed, but people have done it successfully. You're going to need a towel. You're going to fold the towel along its length, because you're going to use this to create a bit of fill for the low back area so that your low back is in a comfortable degree of arch. It's not designed to be flat for most people. Most people like a comfortable degree of arch. So you're going to use this to create that. In addition, depending on how your upper back is situated, you will need to adjust this pillow configuration. If you have a rounded upper back that can't straighten out, you may end up having to put a pillow here so the bottom edge of the pillow is supporting your back as it comes away from the bed, and then another pillow here, so there's another layer of support, and you create steps so that the upper back is supported in a way that suits it. I am not too rounded in my upper back, so I'm going to use this configuration. Same advice getting down. Walk yourself down, and when your core is somewhat tight, again, you're going to tighten your core and ease yourself onto your back in as many little steps as you have to make it bearable. And then, once you get on your back, you will play with the position of this towel. And you may, in fact, have different sizes of towels to get the dimension this way and this way well suited to you. So I'm going to put it down a little bit, give myself a second. It doesn't feel as good as where it was. Put it up a lot. Well, that doesn't feel good either. Put it down, but not as far as last time. It's getting better. Put it up, getting better. And you have to take a few seconds to settle in and decide whether the position is best suited to you. And fiddle with it until you get it. And you'll know when you get it, because it'll feel different than any other position. I'm going to just take a little liberty here. This should have been in a position for me to use before I started the procedure. So here I am. I've got my legs up on a stool. First time you do this, you may have to have a buddy help you so that they can move the stool and you don't have to do what I just did, because that's kind of tough. Okay, I've got my shins horizontal. I've got my thighs sloped down a smidge. They're not vertical, but they're not flat. I've played with different surface heights here by using pillows and towels underneath my shins until I've found something that feels right to me. I've got my head supported well. My forehead is level with my chin, or maybe my forehead is a little higher than my chin. I've got my pillow or my towel here, and my legs feel nice and relaxed. And now I'm going to focus on letting all my body parts fall onto the surface I'm lying on. Might want to get some meditation recordings or music that soothes you, because here is where I'm going to use my brain to cause my muscles that are way too jumpy to calm down. And if this is done well, and if this is set up in the best way for you, it can be remarkably comforting. So I will work at this and focus on relaxing for 10, 15 minutes, possibly at lunchtime and maybe at the end of the day, so that I can rejuvenate my spine to deliver a little bit of comfort and function in the times between applying this piece of advice. People who are really sore will do this for 15 minutes of every hour. People who can get through a bit of their day may do it a little less often. And when I'm done doing this, I should feel quite a bit better than when I started. Now my back is set up to do a little bit of desensitizing movement. So you get your buddy to help you off of the stool, or what you do is you tighten your core and you get your legs down one at a time. Okay, kick this out of the way or get it out of the way somehow. I'm going to do this. And now I'm going to go back onto my back with my knees bent, get rid of this, and start my desensitizing movements. First maneuver is going to be a pelvic tilt. So I'm going to roll my pelvis so that my belly button comes up to my chest, and it's going to be slow and non-alarming to my spine, and small enough so that I get some movement but I don't aggravate myself from the degree of discomfort I was at before I started. And then I'm going to roll, let it relax back to where it wants to go naturally. And now I'm going to roll it the other way, where my chest and my stomach go out. Relax back to where it wants to go. Roll so that my back presses into the bed, my belly button is pulled up to my chest. Always slowly, always predictably, and always with a focus on relaxation. Your objective is to not aggravate back pain, thereby convincing the spinal muscles that are so jumpy that movement can happen and not be painful, so stop being so jumpy. So it takes some focus to do this. And in fact, when things are really sore, you may not be able to do this successfully. You simply try it again later if you can't do this in a non-alarming way or non-painful way. Just defer and do it another time. So you might do 10 of these in a nice, unhurried, relaxed way. Then you apply similar principles to pulling the knee to the chest. Ease your knee toward your chest to the edge of sensitivity. When you get there, give yourself 2 or 3 nice, relaxing breaths while you're there. Feel any irritation or increase in irritation abate, and then go back to your starting position. And then repeat that 5 to 10 times on this leg, and then 5 to 10 times on the other leg. Then allow your knees to roll your pelvis to one side, cautiously anticipating the beginnings of increased irritation and stopping at that point, or maybe on the second rep before that point. When you get to the point of either the edge of sensitivity or just before the edge of sensitivity, you're going to give yourself some time to use mental relaxation and relaxed breathing to quiet down the muscles. And then you're going to ease yourself back into the center, allow things to settle, and repeat the process in the other direction. Again, 5 to 10 times. And that is a procedure that's helpful for a lot of people. Off onto your side to get yourself in sitting. When you're sitting and you want to get up from sitting, rather than lean forward in the normal way, put your hands behind you, put one foot behind you. The one that is best will be the one you spontaneously choose. And then ease yourself up like that without bending forward. Much nicer. Ease yourself down without bending forward. In regards to sitting, it's often useful to put some material behind your low back to keep the hollow of your low back present while you sit. Because it's normal, somewhat natural for that to be lost, but when you're suffering from a acute back pain episode, losing that hollow is sometimes not very nice. So sit back deep in your chair, get a simple rolled towel about as big around as your fist, place it behind you, and fiddle with where it feels best, which will be different person to person, and then relax like that. Sometimes people will not use a roll. It'll be better that they don't. You do what makes your spine happy. And then taking the weight of your arms off of your upper back is also useful for some people. So I hope this has been helpful to you and allows you to get some comfort and some peace of mind while you await your appointment to see your physician or your physiotherapist. And best of luck, and make sure you get that diagnosis. Thanks.